I think today's topic is extremely interesting. Even though we keep on listening to why accreditation is important or what are the benefits of getting accredited with an international organization for your healthcare facility, let me break it down for you. Let me walk you through why accreditation is more important than a trophy and how to make it transform your organization. We will break this topic down for you, and I will answer all your questions at the end of the session. Let me take you to the objectives, what we will be discussing in this session today. We will be highlighting why accreditation is more than a certificate or a badge. We will also understand how accreditation strengthens the process and culture of the organization. We will explore the long-term value beyond the initial certification, and we will also learn how the organizations can use the accreditation as tool for continuous improvement. By the end of the sessions, you will clearly understand why accreditation is much more than a badge or a certificate. We will also look into how the organizations can move beyond the initial certification and use it as a continuous improvement. And most importantly, we will also discuss how accreditation becomes a long-term strategic advantage to your organization. Um, Moving on, um, let me talk about why it is beyond a certificate or why it is beyond a trophy or a status symbol, rather for your organization. I think when the organization decides to get accredited, your well-being or your journey of well-being starts from there. The true value lies in the organizational transformation. The journey drives improvement, or more than the award itself. Your focus shifts on why, on achieving certification to achieving excellence, and serving your patients better to improve the patient experience or overall experience of your hospital. In addition to that, accreditation also strengthens the system, the culture, and the performance as a whole of your organization. Now, many organizations focus on getting accredited, but the real value lies in who you become throughout the journey or during and after the process of accreditation. Now, accreditation pushes the organizations to review, refine, and redefine the systems, often for the first time in many years. Okay, and I'm sure you agreed with that. What kind of documentations you need, what kind of certifications are in place, what kind of licensing are in place. Generally, all of these documents are checked and cross-checked and cross-scrutinized once you decide to go for accreditation. Of course, you have a huge quality team that will be monitoring all of this information. But I think when you go for accreditation, that's when the entire mojo develops and everybody's together and working towards these official documentation. And I feel the most improvements happen before the certificate actually arrives. So when the goal shifts from merely achieving a certificate to achieving excellence, that's when you see the real change happening. You will see that happening in real time in your organization as well. Now, coming to a structured framework. Why do you think accreditation provides a structured framework to these organizations or healthcare facilities? I feel according to me, or according to the kind of research I have done in my experience, it says that accreditation gives a structure which is a clear evidence or a clear evidence-based framework or a blueprint that guides the entire organization. It defines the roles, responsibilities, documentation pathways, and processes, and gives you a consolidated report as to what has to be followed to the T. It, of course, provides clarity across operations, it enhances accountability, brings consistency in the process, and it's very evidence based and it's recognized by standards internationally. So there's a lot of accountability comes to an organization when it once it goes for accreditation or decides to start that journey. I also feel this is why the organization often show more reliability and fewer errors once you are accountable to this kind of framework or international standards, or for that matter, even national standards, I feel. I see there are certain questions in the chat, but be sure that I will address to those at the end of the session. Let me quickly walk you through the process of accreditation and how we'll be strengthening the organization through this process. Now, coming to strengthening processes, what do you actually mean by strengthening processes, apart from the alignment of the team or the unified workflows? I feel one of the biggest impacts of accreditation is process strengthening. Okay. Errors reduce because they follow a standardized pattern or workflow, other than the individual habits, or the habits that they pick up during their experience of many years. Team aligns better, this better or improved communication, and I think the duplication of work kind of decreases because you know what is the exact process, what you have to follow, the kind of blueprint that you have to follow throughout the process. And then there's a lot of internal coordination that becomes smoother because everyone knows what the right looks like. So of course that reduces errors and risks, that builds proactive, not reactive management, and it improves the entire coordination right from the management to the subordinates, or to the bottom of the hierarchy. Everybody is well aligned and well versed with the process. So I think strengthening the process is one of the most important uh, you know uh, important outcome of the accreditation as a whole. Now, coming to operational and cultural improvements, what do you think that accreditation as a whole can bring in some kind of cultural improvements to your organization? Or let me know in the comments what do you think about this. Do you think the culture improves or the operational efficiency improves? I'd like to know more about you. I mean, more about it from you. According to me, I feel it's in improved communication and it's safer daily practices, stronger documentation, and more reliable outcomes. I feel accreditation does not only strengthen the operation, it transforms rather the culture and the operational efficiency as a whole. Communication of course becomes clearer, and there's transparency that increases, mistakes are reported, and they are discussed and rectified in an orderly fashion. There's patient experience that is enhanced, and I feel the patients are also very educated and very knowledgeable. When they walk into the hospital, they know whether this is the right place for them or it's not, and they're very vocal about their experiences. So I feel once there's an entire framework that is in place, your organization as a whole grows in terms of patient reviews or patient experience. And then there's a lot of satisfaction, of course, that comes through the patient experience. Staff begins to engage more deeply because the processes make sense and it's not repetitive or boring, or the errors are decreased. I feel the accreditation brings about an entire package as to how an ideal organization or ideal healthcare facility should look like. you know uh, Documentation, of course, becomes very accurate, dependable, which supports the quality and patient safety. There could be interoperability of data that could be followed very easily. Data can flow from one place to another if all the processes, of course, are in place. It is monitored. You know that it is protected, well protected. There are no loopholes. All of this is a bigger part, or a part of a bigger picture. Rather, I would say audits are viewed as an opportunity for improvement, and they're not looked at as threats. I feel that is so important to inculcate a culture of responsibility and accountability rather than fear of audits. I feel people who've joined in from quality can attest to that testament. Um now, moving on to the very important part of accreditation, why it's not a trophy or just a mere certificate as a whole, as of now. I feel leadership and empowerment has to go hand in hand. Okay, what kind of empowerment or the kind of employees feel comfortable in a setting where all of the framework is followed right from the top tier to the bottom tier? Leaders become more involved in quality, and I feel that accreditation increases leadership involvement, uh, in terms of leaders actively try to participate in quality discussions, even though they're not from the healthcare background as such. Employees feel empowered because they are a part of the process and not just, following instructions here and there. Reporting increases not because the problems increase, but because the culture becomes more open and and honest and feels like home, honestly. And with the stronger systems, I feel that the teams feel more confident experimenting with new ideas, leading to innovation as a part of their everyday habit, rather than, just showing up when there's an audit or a survey and then haphazardly managing all the documents and then missing the documents and, focusing on the corrective plans later on. I feel the involvement of leadership also makes an important change or shift in change when you talk about accreditation process as a whole. Of course, the innovation then becomes part of their daily work. There's free flowing communication between employees, right from their subordinates to their superiors, and then there's no, there's constructive feedback that happens or that goes on. There's increased. The employees feel that they own the place, and with ownership comes accountability as well. Now, moving on, what do you think? Do you think that accreditation brings in the kind of long-term commitment to quality and patient safety, or do you think it's just like a one-time achievement or a lifetime achievement award that you get and then you place it in your cabinet? I don't feel because the healthcare and the digital health space is evolving so much. I feel it's a long-term commitment, and that's how it should be looked at. It's not a one time project or a single time investment. I feel it is just the beginning of your journey towards excellence. Accreditation is not it's not a one time event that you can celebrate and get over with. The real impact actually begins after the certification. A certificate is simply a validation that the that your organization has potential and it's doing better, but then what you do after getting the certificate actually shapes the entire future of your organization. Sustaining quality requires ongoing internal audits, continuous training, regular process updates, and impeccable monitoring of all of these. Over time, data driven discussions making becomes routine rather than forced. And this is how accredited organizations maintain excellence even after years of certification. Have you noticed that maybe a very popular hospital in your area and a less popular hospital in your area, do you see the kind of in terms of accreditation, of course, not in terms of popularity. Forgive me for mentioning the word popular, but I feel in terms of accreditation, if you see a hospital which is accredited and the one which is not, you would feel there's a stark difference in the kind of work culture when, as the moment you enter or the moment of from the time of admission to the time of discharge, you will feel that the entire culture, the entire vibe of the place changes. Okay, and these habits are inculcated via accreditation processes because they have a framework that they can follow. Now, coming to long-term commitment, um, I I think I've spoken enough why it is important in terms of long-term commitment and continuous quality improvement and so on. But again, it shouldn't be looked at as a trophy that you've earned. Of course, there's a lot of hard work that goes on behind getting a certification or getting recognized internationally or even nationally for that matter. But the real impact lies if you commit to it for a longer period of time. Now, when we speak about trophy all this time, that accreditation is not a trophy. What do you think is a real trophy? I would like to really know your views in the comments. Please feel free to add comments in your chat box. I will quickly finish this and get back to you. I can see a lot of people are chatting in the chat box. So coming to real trophy, it's not the accreditation on the wall. The real trophy is not what hangs on the wall post the certification is done. It's what happens in the daily operations, right? It's the trust that you build with patients, partners, and your entire workforce. There's consistency in delivery of quality and patient safety. The accreditation becomes a part of the entire competitive advantage only when it becomes a part of your organization's DNA. That's the real trophy. Excellence becomes a habit and not just an external requirement to show to your patients or to show to the healthcare market in general or to show to the government or regulators, but that becomes the very essence and part of your DNA. Now, I think we have come to the end of our session, and I'm so passionate about healthcare. I can keep talking about why accreditation is important. But thank you for attending this session with me. Um, I feel that with this kind of discussion that we've had today, it will help you view accreditation as a means to transform your organization and as a journey rather than the final destination. And I'll be happy to answer your questions that you may have and discuss how your organizations can move beyond the certificate to sustain excellence. I would be more than happy to answer that for you. But just in case you've missed something and you want to go and recollect that, you can always go and visit our YouTube channel. The recording of this will be available for your review. Thank you.
Bye bye.